Hello, this is Lisa Iguchi with the Oregon Health Authority. This is a quick learn video to review the optional COVID-19 vaccination tracking tools for staff and residents in long-term care facilities. These tools are optional but are intended for facilities to be able to track and report summary counts of COVID-19 vaccination data to the Oregon Health Authority on a weekly basis. We have recently updated these tracking tools to reflect a change in the up-to-date vaccine status definition. Previously, these tracking tools calculated someone is up to date if they had received all completed primary vaccines, as well as at least one additional booster dose. However, starting with this quarter of reporting, which begins the week of June 27th, the up-to-date definition has been changed to reflect the current CDC guidance. That is, individuals who have received all of the vaccines in the primary series and all booster doses when eligible. In particular, this means that if any individual is 50 years or older, they should receive a second booster dose when eligible. Similarly, if there is anyone 50 years or less than 50 years, but has moderate or severe immunocompromised status, they are also recommended to receive a second booster. If anyone in these populations has not gotten their second booster and they are eligible to, they will not be considered up to date. There are three columns that I want to highlight on these updated tracking tools that will help us to better calculate up-to-date summary counts. The first column here is column F. This column on the staff sheet asks for date of birth. It is important to fill this column out to determine if someone is eligible for a second booster dose. The next column I want to highlight is column Y. This column has been added and asks whether or not someone is moderately or severely immunocompromised. The guidance is to select yes if a second booster dose is recommended for individual because of their immunocompromised status. If this information is not known or unavailable, you can leave this column blank. Lastly, there has been a column added to the end called up to date. This column will populate as yes when an individual is considered up to date. And these counts will be used to determine how many individuals in your facility are up to date on the weekly reporting. There's also a reference link to the guidance document above. Now I will show you how to copy and paste your data from your current tracking tools into this new updated tracking tool. I'm going to be showing you with test data for the staff sheet. You can do the same thing for the resident tracking tools. It is a very similar process. So I've already copied data from my prior tracking tools, and you should have data for columns B, the start of employment date, all the way up until column V for staff, which is about second booster dose information. When I want to copy in my data, I'm going to click on this first cell of data entry here, right click, and I want to paste the values down. So click on paste values. Once I select that, the information should populate. And you can just double check here to see if all of the information looks as expected. You should have information about date of birth populated here. But if you do not know an individual's date of birth, you can use a proxy date. For example, if you know someone is less than 50, you can enter in January 1st, 2000, or if you know someone is 50 years and older, you can enter in January 1st, 1972. Please make sure that all the information in this column is filled out appropriately. Now, you can also fill out if an individual is moderately or severely immunocompromised. So here I could select yes if Pat Baker in my sample data is considered immunocompromised and I have this information. What you'll see on this last column is that certain cells will populate as yes if an individual is considered up to date, or it will be blank if that is not the case. There will be different reasons why the up-to-date field gets populated as yes. For example, with this individual, this person is considered up to date because they are 50 years and older and are immunocompromised. So they are recommended to get at least up to the second booster, and they have received that. So because they received all booster doses when eligible, they are considered up to date. For this next person that's considered up to date, although they haven't gotten their second booster dose, as you can see, they've only received their first booster dose. They are under the age of 50, and so what is recommended for them is just the first booster dose and not the second booster dose. So in this case, they are considered up to date. If you go to the weekly summary counts, you'll see now that for the week of June 27th, 38 total staff in the facility are considered up to date, meaning that they have completed the primary series and received all booster doses when eligible. Please copy your data in from your existing tracking tools into these new tracking tools and use this new sheets going forward, starting from the week of June 27th up until the end of the quarter, which ends in September 2022. Additional guidance will be provided if the up-to-date definition changes after that point in time.